Hi, everyone. Thank you for joining in. We're so glad you're here today. Our guest is here with us on board. We appreciate everyone for today. Thank you for joining in. We're- So I am about to introduce our guest, and she is excited because it's been a long time coming together and also as a family friend of mine. So I will be introducing her officially to encourage all of us to learn more about who Mrs. Olajumoke Ayodele is. Ayodele is still a maiden
Adegbola.
name, but she is a Mrs. married to my very friend here in the United States. So, who is Mrs. Olajumoke? Kindly unmute your mic, please, everyone. Okay, let me just mute everybody. So once again, please unmute your mic. Thank you all for coming in, but unmute your mic, please. Do well to unmute your mic. Do well to unmute your mic. Thank you. I appreciate that. I know the Wellbeing Matters community, we all respect each other, and I'm so glad you're keeping up with me. Mrs. Olajumoke is a dedicated, registered nurse, also a public health advocate who currently works with the Hospital Corporation of America, a leading healthcare organization. And she has a very cute boy who is above 2 years of age. But more importantly, she's here to share with us her journey as a mom and also her experience as a healthcare practitioner working closely with mothers and newborns for the past 7 years. So with love in our heart and our community, please welcome Mrs. Olajumoke here, and thank you for joining. Here you can. You're muted, ma'am. Okay, let me unmute you first. Okay.
Okay, yeah. All right.
Okay.
It wasn't allowing me to mute myself before.
Thank you.
All right. Hi, hello everyone. My name is Olajumoke Ayodele, and well, that's my married name, but I've just been so lazy to actually switch it legally. Then, just as
Okay.
Dr. Mary has said, I'm a registered nurse and
Your sound, ma'am.
I work CA.
Sorry, we can't hear you. Mm-mm. If you can hear, I put in the chat. You're muted. Hello, can you hear me?
So I can't hear you.
I can hear you. Maybe it's your AirPod.
Oh, okay.
Oh, better now. Yeah.
Yeah, I can hear you now.
Okay, it's better.
Okay, I can hear you now.
Thank you.
Okay.
It's
So,
fine. It's our conversation. Be
all right.
calm. We are here together.
It's okay. So, yeah, just as Dr. Mary said, I got to know her through my husband, who is also a registered dietitian, back home from Nigeria. I'm from Nigeria. We're from Nigeria. And then when she asked me that, oh, will you be able to, come talk to the Wellbeing Matters community moms? I'm like, okay, when is it gonna be? And then she's like, oh, it's gonna be in August. And okay, no problem. So I've been asked to talk about the essential postpartum checks for
Okay.
the new mom, right?
Yes.
So, without wasting much of the time, I have a little like presentation, like a PowerPoint here. I'll just go through it and then we can go over questions that you all might have. Can you hear me?
Yes.
Okay, all right. So essentially, what's postpartum? Since the beginning of August, we've been talking about postpartum, this, postpartum, that, August being the breastfeeding month, World Breastfeeding Month. Postpartum essentially is just the period after the baby is born. Usually, well, medically, we say like the first 6 weeks, but I promise you, postpartum is beyond the first 6 weeks. It extends way, way beyond that because, so many changes occur when a child is born. Like a child is born, a mom is also born. So there are different, changes, physical, emotional, psychological, all of that changes that can ensue during this postpartum period. Okay. And it could also be a period of self-discovery for the new mom as well, because you're engaging in a new role, right? As a mom. So for this presentation, I want us to talk about these checks based on the different aspects of health. Because majorly, what we want is for the new mom to be on the good side, on the positive side of the continuum of health, right? And how do we do that? We have to talk about the different aspects of health as pertaining to the postpartum period that the mom is actually going through. Okay, so we're going to talk about the physical aspects, we're going to talk about the social aspects. We've talked a lot about the social aspects last week, Saturday, I believe, when we had the family nurse practitioner talk to us on this forum. So we're going to talk about the financial aspects and, of course, definitely the psychological aspects. Okay, so let's talk about the physical. Essentially, for the baby, what does the baby want? The baby wants you to, you know, feed appropriately. And what do you need? God has given you what you need to feed your baby, breast milk, you know, except for like a minority that might not be able to actually breastfeed. Many women are actually able to actually breastfeed their moms, and even those minor percentage of people who cannot breastfeed, with appropriate help, they can actually they will be actually be able to produce and breastfeed their baby. So what does the baby want? Once you're able to feed them appropriately, clean them up, give them comfort, give them nourishment, give them warmth, dress them up appropriately. When I had my baby, there was this woman who came around to come help me then, and she'll be like, hey, do you know how hot the womb was? You need to dress this baby up, wrap this baby up. And this boy will be hot under the old blanket. We don't need all of that. We don't need to overdo. See what your temperature is. Even you yourself, they usually say, one thing we usually say is that the layer of clothing that you will wear that will keep you warm, add one layer and the baby is good. So you don't have to overly wrap them up and package them and bundle them up like, hey, this is what is, all of that. And then the baby also definitely needs attention. When you have a newborn, that they always want you to, rock them and carry them and, love upon them and all. And then apart from that, one thing I have noticed that some mothers don't know they should do is oral care for their newborn, especially if, in fact, not even just newborn, until that first tooth actually erupts, you need to do oral care for your baby. What do you need? Wash your hands. You need a clean, like a piece of clothing, wet it with a warm cloth, and just wipe them out in the morning and at night. That's all. And then so that by the time that first tooth actually erupts, it will be much more easier because you've actually been cleaning even when there was no tooth then. It will be much more easier for the baby to say, okay, I think this is the continuum. This is what we've been doing. We're going to continue doing this. Okay. And definitely a baby definitely needs you to be their advocate, because when they were in the womb, Nothing was bothering them. They were good. They were fine. They were chilling in there until they finally came here. And then, regards to our grandmoms. And then the grandmom comes around and she's like, okay, let's do this gymnastic for the baby. After bathing, you're pulling, you're tugging, you're doing this and that. If you don't feel comfortable with it, please, the baby cannot talk and say, hey, my hand, my legs, things like that. If you don't feel comfortable, respectfully, please, can we limit this? Can we do that? Because the baby cannot actually advocate for themselves. They need you to advocate for them. Okay, that's that about the baby. And then for the new mom, it's very, very possible for you to. It's not even possible. It's like whenever the baby is born, we just put ourselves as secondary, and then the baby becomes the primary. Of course, it is essential to take care of that baby, but please don't lose yourself as well. Okay, try to shower. You don't have to soak yourself in the bath and then keep. You don't have that time. We know we don't have that time, but definitely, you need to please try to take care of yourself. A quick shower, do your hair, eat appropriately, stay hydrated. And for mothers, okay, who probably during their pregnancy period develop some complications and things like that. Take for instance, I had someone who had pregnancy induced hypertension, had gestational diabetes, things like that. Because the baby is born now doesn't mean everything just jumps back to normal. You have to follow up and take care of yourself. You understand? Even though you are busy with the baby, you have to be alive to be able to take care of that baby. You have to be ill and healthy to be able to actually take care of that baby. So you have to find time, make out time, okay, to actually follow up with your doctor, have your checks, your glucose checks, your blood pressure checks, your medications, be on top of that, okay? Um, then we've talked about the physical parts. Also, for mothers, especially the first, 6 weeks when we have like the leukemia and we are going through like the blood and then the pinkish and then the serous part, you have to monitor that as well. In as much as you're monitoring your baby and you want to make sure they're okay and they are well fed and they are, thriving, you also want to monitor that. Do you see that blood? I mean, by the time the first 3 days, right? You're expecting it to be bloody. That's the lochia, and then it's gonna go ahead and change to something pinkish, and then much more clear, much more serous in consistency. But if you are noticing that, okay, I had blood and then okay, it's turning pinkish, and then all of a sudden it's now bloody all over again. You have to be self-aware about that as well and follow up with your doctor. If you're noticing something that seems to be strange, please ask questions. Don't just presume or assume that okay, maybe this is how it usually is. Even for CS moms as well, you definitely will see look here as well because you gave birth to a baby. You just didn't push that baby out. The baby was born. Okay, you gave birth to that baby through a cesarean section, so you are still also going to get lochia as well. I did have a cesarean section due to some things that occurred during the labor process when I was having my baby. And then, okay, I knew I would have lochia, right? But then I didn't know that it would be like, I mean, see, I didn't know it would be that. I was like, on the third day, I was like, okay, Shebi was supposed to have Nokia Rubra, the red one, and then the third day she was like, why is this still bloody? Why is this still, there are so many things. I'm telling you, this period, when it happens to you, happening to you is different from actually you learning it in textbook. Okay. I didn't know that with CS, you could actually bleed more than 3 days because you had a surgery. I didn't know. I was like, wait, I thought that it's supposed to be just clear now, but what is happening and all of that? And then I was like, okay, let me book appointment. And you're like, girl, calm down. All this is normal. I'm like, okay. So it's good to just go ahead and ask questions. It's definitely essential because the fact that what is normal for another person might not be normal for you. Okay, so definitely, please. Let's talk about the psychological aspects, right? Of these essential checks that you need to do. First, you have to be mentally prepared. Physically, you had 9 months, right, to prepare for delivery of the baby from the first period when you found out you were pregnant. some people 10 months, Steph. Okay. You have to emotionally get yourself ready, like psychologically get yourself ready, because this baby that is being born, you don't know if it's going to be a baby that loves to hear that voice, that will be crying consistently, and then you're like, why is this baby crying this much? Or it can actually tell you when you have someone that, okay, probably someone gave birth at the same time as you, and they're like, that baby sleeps through the night, that baby is so good, and here is your own baby, just a single finger on them, you're already crying, and you're like, hey God, even where did I get this baby from? And you have to be psychologically ready to face whatever it is that comes your way. But one thing you should know is that the baby keeps on growing. The level they have today is not the level they will be tomorrow. Okay, they will keep on getting acclimatized to the new environments that they are in, right? And then another thing, though, that I would say is, there's something they call maternal instinct, right? Like your gut feeling. If you notice that something is going on with your baby, I've seen a case whereby the the way the baby was breathing, it was actually the way the mother noticed that, okay, this baby is, she's not even a nurse or a medical practitioner, but she just noticed that the way this baby is actually breathing, it was like using accessory muscles to breathe. Fine, we know newborn infants, they don't breathe like we do. They breathe really fast and then they take your time, and then they breathe really fast and then they take. But if you notice that this baby seems to be like, you know, have has like a bluish discoloration around the lip, or you are looking, you, there's just something they call maternal instinct, and it's good for you to listen to that when it comes to your baby. And you have to have a clear cut, like, boundary between maternal instinct and anxiety. Okay. Why I'm saying that is, because we know normally, right? Mothers, you have it in mind to just care for that baby. You have it in mind the baby is all over your mind, right? That's all you are thinking about right now. Okay, and it is normal. It is totally normal, because I mean, it's a natural instinct that just comes on without you even doing anything about it. But when you start noticing that you get overly anxious about nothing, you just jumping up and you're like, hey, is the baby breathing? Oh, is the baby doing this? Oh, what happened? You can't even leave the baby for 1 minute, because you're like, what if something happens to the baby? Please seek help. Because you might start launching yourself into postpartum anxiety. And normally, majority, like 80% of mothers usually have postpartum blues, right? And then they'll be like, you just, when the baby starts crying, you're like, oh, what do I do? How do I do this? How do I do that? Or things like that. You understand? But there's a clear cut between postpartum blues, the anxiety when things start getting much more intense and you are just anxious for nothing, and then that's a precursor for that particular person, to go on ahead and move into postpartum depression, which we don't want. Okay, so you have to be like psychologically ready for this period. um and if you have a baby, of course, according to research, right, the crying of babies usually peak around 2 to 3 months. That's when they seem to cry a lot, and then slowly it starts declining. So tell yourself, you have a baby that cries a lot, just tell yourself, okay, this period will pass. If you need to put the baby in a safe place, put that baby in a safe place. Step out, get some fresh air. Okay, step out, get some fresh air, and come back and carry that baby. Because in a situation where you are so overwhelmed, you can do things that you shouldn't do. We've heard of people who really love their baby so much, but then they shake their baby. I don't know if we've heard about shaking baby syndrome. They shake their baby so bad because they're like, what is wrong with you? Can't you just keep quiet? And all, and then by the time they are over the period, the deed has been done. Okay, so we should definitely have our minds prepared and know when to put that baby down and breathe. And then another thing that could psychologically affect people that I have seen is when you've had it in mind, right? That, oh, I'm going to exclusively breastfeed my baby. And then lo and behold, the baby is here and the baby is not latching. Or let's say the baby is even latching and no breast milk. It can psychologically affect you that you feel really down. You start self-pity and self-loathing. We shouldn't, do that. Instead, seek for help. Ask for help. Hey, I really want to exclusively breastfeed this baby, but this milk is not coming. What do I do? We have lactation consultants. Oh, this is their work. They know how to, draw like a meal plan for you on how to increase that breast milk production, teach you on how to put the baby to breast to allow for essential milk let down. Okay. So you should definitely please seek help. Don't give room for self-loathing. Don't give room for self-pity. Okay. That could lead to the part of depression, which we do not want. And all right, let's go on ahead and talk about the social aspect. Well, I wouldn't really draw much on this because we've spoken about it last week. You should know what help is, available to you, and please be open to actually receiving this help. Many African women, the way we've been, I don't know, maybe it's the way we've been trained to stand on our own, and this is it. We face it and we do it by ourselves. And no, please, nobody is an island. Nobody is. There's no award as the most able to do it by yourself. There is no award like that. If you have help, please. And this is where the husband comes in. Please, it didn't take only one person to give birth. It takes two people to actually make this baby and actually, take care of this baby. We usually say that it takes a village to care for the baby. The village starts from the husband and the wife in the house. And then if you're now able to get people around, let's say your mom is around, like, hi, personally, now, when I had my baby, before my mom was even able to come to help me, my husband he stood in, you know, and then we had like a church member who came on along to help me clean the house, do this and do all of that. She was even surprised because me, that I knew that nobody was around with me, I had already stocked up the fridge and all of that in preparation for when the baby will come. All right. So these are some of the things that you can do. And please, if you have someone that is able to help you, please and please, especially if you are in like the diaspora where your neighbor might not even know that you are pregnant. Your neighbor might not even know that you have delivered. Once they are home, everybody lives their own life in their own way. So if you have help, please be open to receiving the help with direction. And then definitely financial aspect. Babies are expensive to take care of. Everybody knows that, especially after that first. In fact, from the time they are born, safe. Here in the United States, if you don't have like the crib, if you don't have like your car seat, all of that, nobody will give you the baby, even though you're the one that gave birth to the baby. When I gave birth to my baby, I had a nurse that came all the way from wherever she works. She came to come and inspect the house, make sure everything is in order, help me to set things up and all of that. Okay. And it is money. If you are back home in Nigeria and you're like, oh, baby will sleep beside me on the bed, there's no need for crib, which is not a safe, which is not safe actually, because the baby should actually have their own designated sleeping place, their own crib or their own bassinet for safety. Okay. So you have like 9 months, a whole 9 months to prepare, to plan. Let's say you didn't even plan on getting pregnant. The pregnancy just happened. Now it has happened. You have 9 months to start saving up in preparation for when that baby will come. Diapers are expensive. Breast milk is free, but you must stay hydrated. You must stay nourished in order to produce nourishing breast milk too. So that one is also there, right? And then if you're not going to be working, back home in Nigeria where I used to work, they give you like 6 months maternity leave and it is paid. And here in the United States, if you are lucky enough, you get 8 weeks or you get 12 weeks, depending on where you are working. And it might not even be totally paid for. If you have short-term disability, you get it. If you don't have it, you open your mouth to the fresh air because there's no money that will come in. So you have to plan appropriately for when you will be at home because you have bills to pay. All right. And then you're already preoccupied with the baby and all of that. You don't want to add another headache to whatever it is you're thinking about, just you're going to start thinking about money and all of that. So you have to plan appropriately and plan for resumption as well. If you're going to resume work, but some people just go on maternity leave and they don't resume back to work. If they're able to do that, all well and good. But if you're someone that you know that you must work, you have to plan appropriately for when you're going to resume as well. I personally, what I did then, okay, I was able to get 3 months leave, right? I had to tell my husband, we want to do exclusive breastfeeding, right? Let's get freezer. He went ahead and got freezer. Got so good. I produced a lot. I was able to freeze a lot of breast milk in preparation for when I will resume, right? So that, and that one as well allowed him to also be able to, feed the baby when I'm not around, and when I need to get some rest, he's able to feed the baby. So all of these things you have to plan as in preparation for when you're going to actually, face the whole world. But I don't feel like the whole world is enjoying life and you are here making milk like a cow. It's a process. It's a See, what I would say is enjoy that period. You're at home. It's even time for you to be fresh yourself because you're not entering the sun. You're just, just taking care of your baby and putting your mind at rest alone self will give you peace of mind during that period. So plan appropriately. And of course, I know back home in Nigeria, I don't know, I haven't worked in like a lot of other places. I've worked in Nigeria, I've worked here in the United States. I know back home in Nigeria, we take breastfeeding, like for you to pump your milk and all, there's no big deal about it. But here, some people will even sexualize the fact that you want to breastfeed your baby outside or you want to pump that milk outside or something. You can liaise with your manager. I don't know this. I think we need to be more open to. I think people need to be more open to understanding that breastfeeding is a fundamental right of a baby. It's not something that should be sexualized or something. I personally, when I resumed work, I told my manager. My manager also she was like, no problem, come into my room, my office, pump whatever milk you need to pump, use the freezer there, store it there, and then take it home with you anytime. So you need to, if you have to liaise, okay, with your place of work or something, if there's going to be like a they call it what do you call it here? They call it like a room,
Lactation,
like a lactation room
nursing
or
room,
something, a nursing
nursing
room or something, where you will go in and go in and pump your milk and preparation because you have to work, right? So in summary, just to sum it all up, right?
room. I
We've
was
talked
about
about the
talking
physical.
about that.
Yeah, I know, I'm timing myself as well. So we've talked about the physical aspect, right? We've talked about the
Okay.
psychological, which is very, very important. Mothers, please take care of yourself. It is when you are well psychologically, physically, mentally that you can actually take care of your newborn, right? We've talked about the financial aspect, even daycare, that you have to go and put your baby in daycare when you resume work because here in the United States or wherever it is, even back home in Nigeria, you have to work. Husband will work, the wife will work. If you are lucky enough and you are back home and you have someone that will stay at home with the baby, beautiful, that's the best. But if you don't have anyone, you're on your own. You have to go ahead and maybe put the baby in crèche or something. Plan ahead. Even before your maternity leave finishes, start looking, where will I put this baby? What's the plan for this baby? Let your husband or whoever it is you have around start, touring. That's what we call it. You tour. Okay, this daycare, where will you be storing this milk? Can I see? How do you do your stuffs here? How do you clean things up? Because the baby is so small. They're not done with their vaccination series, right? And you don't want to expose them to things that they shouldn't be exposed to. Okay. So you can start from when that baby has been born, and before that maternity leave is like a week to the end or 2 weeks to the end, and you're like, hey, what do I do? And I'll start planning ahead for resumption right from when that baby is finally in your hands. Okay.
Thank you for that.
Yeah. All right. Thank you.
Yeah, I will start from where you ended because I
Mm,
have a chat here
okay.
about how a new mom can handle the postpartum phase. I don't know if
Mm,
my viewers can see it, but our community members will get access to the recording. So I think we'll focus more on that. You
mm,
mentioned workplace support for postpartum and breastfeeding. But
Mm-hmm.
before we look into that of, oh, requesting support at work, access to nursing room, which I also benefited from while I was at Tech, like Texas Tech University, as a place of work, I realized that even mothers don't advocate for themselves. So,
Yeah, you have to
from
speak up.
everything you've said, how
Mm-hmm.
do you encourage mothers to build their confidence back? Yes, postpartum check, we'll talk about the psychological, the baby blues, postpartum depression, but also in advocating for yourself, either at work or at home, or I need support, or I just need to
Mm-hmm.
sleep, I need to rest. How do you encourage new moms, especially from your experience, to advocate for yourself that, "Ah, please, oh, I don't tire," you know?
See, a closed mouth, we say a closed mouth is a closed destiny. That's the first thing you have to know. You cannot, the fact that you are thinking that, oh, I need something, and now this person should know that I need it, doesn't mean that person knows that you need it. That person might have 1,001 things going on through their mind, and you are like at the bottom. They are not even thinking about you right now. Even though they know that you will need it, oh, but it's not even occurring to them that, okay, oh, this person might actually need somewhere where they will breastfeed. But if you open your mouth and ask, "Ah, please," depending on the kind of rapport you have with your manager, even if you don't have a rapport, the baby is here now. You need to create that rapport. Okay, I need to breastfeed my baby. I've been breastfeeding during the maternity leave, and I really want to do exclusive for the baby, but I don't know where I will be able to pump milk and store my milk for this baby. Open your mouth and ask. You'll be surprised that even people that would seem like they are on their high horses and they are not touchable, you will be surprised that some of these people are actually more humane than you can think. They would help you. So if you don't open your mouth and ask, you want to sleep, and your husband is there just chilling, babe, please, can you please take this baby and just, I need to get like maybe 30 minutes. Let me just close my eyes. If you don't ask, men, their mind may be thinking, in all honesty, might be thinking about work and how to finish up this project and all of that. But if you ask, you bring him back to your own reality. They are in their own reality. You set them to your own reality and be like, oh, this is what I need right now. Can I get this? So please ask him. Ask him, go, 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 is what will help you to actually get what you want.
Thank you. Thank you. That was
Yeah.
so insightful for me as well. Like, when you
Yeah.
be like, I don't know if I'm disturbing, but please, you are both
You
parents.
don't know. Yeah. You don't
You
you
are both parents. We both are responsible for this
yeah.
newborn. So, talking about emotional health and the postpartum blues, can you talk more about postpartum blues? You talked about it in your presentation, but for our mothers that don't know what is the definition of postpartum blue? Is it just that it's color blue or something crying? I want you to go in there so they learn as well.
All right. So the postpartum is just like an emotional period, right? Where
Mhm.
you are happy at the same time these things actually get to you. Because usually we say it's like, oh, the hormones. We usually blame it on the hormones. Like, oh, it's the hormones. That's postpartum blues.
Just crying.
Normally the whole house, normally you be like, ah, this man, and I told him to clean this whole place and all, and you be like, ah, oh my god, this whole place is just scattered, this whole place just, I'm the only one taking care of this baby, I'm not. That's part of postpartum blues. It just make things get to you more
Easily.
than it normally would. The baby is crying, and then normally if you don't have postpartum blues, right, and the baby is crying, be like, oh, the baby is crying, the sound of joy. But when you start having postpartum, yeah, my baby is crying, what is it? What should I do now? Okay, let me carry you. It starts bothering you. It's like the borderline between, oh, I'm totally good, and oh, I'm becoming anxious. That borderline in between is the postpartum blues. And usually we blame it on the hormones. We're like, oh, hormones are just, how are you crying? Is it because I said this thing to you? It makes you just more sensitive. than you
Okay.
normally would. That's the
So
postpartum blues we refer to.
thank you, ma. So I also want to encourage our members that even with postpartum blues, there's a timeline for that. So check in with your
Mm-hmm.
physician, or if you need help, you can get a referral to
Mm-hmm.
a psychiatric or psychological counselor, because
Yeah.
most times they look at your symptoms and diagnose. So we don't also
Yeah.
want to skip over that and say that, oh, it's just postpartum blues to 12 months,
Yeah.
14 months, you know.
Mm-mm. No.
Also, you mentioned something at the beginning of your presentation on you still seeing or bleeding, lochia, even after some days. And that comes to, don't assume, mothers.
Yeah.
Seek,
Don't assume.
don't assume, seek help or seek
Mm-hmm.
your physician's opinion. Go to the hospital. I know in
Yeah.
other parts of the world, in the United States, you can easily call and say, oh, can I come in? But even
Mm-hmm.
if you can, that's why we're talking of finances. Save up before giving birth. And if you don't even have, we're trusting that the Lord will provide. And also being entrepreneurial, we need to plan.
Yeah.
Giving birth to children is not just for passion. I believe it's a
Yeah.
stewardship for us raising kids. So if you know you and your husband are also trying to give birth to another child, for those of us that have one, or looking out for three, four, please plan ahead. And that's why all of these are important, like she's mentioning. You don't want to be like, I need help, but I cannot, and then you seem so helpless. Well, we trust the Lord to provide. I mean, I'm a believer of God blessing the works of our hands.
Supernatural.
Trust
Mm-hmm.
me. But the Bible says the work of your hands. If you are not a Christian, my apologies, but I would say that also plan. When I mean my apologies, I'm not apologizing for being a Christian. I'm just meaning me talking about my experience without knowing what you believe in. But planning ahead is important. Also, nutrition and physical health. Postpartum after 6 weeks, you see your gynecologist. Ma'am, can you share about birth planning after 6 weeks? Is it okay to just say, no, I'm still doing exclusive breastfeeding, I'm fine. It's natural family planning.
Ah.
Immediately you are going for your 6 weeks checkup, start planning. What do you do? I want to hear
See,
from you first. I will share my experience.
by the time, if you want to say, oh, I want to do lactational amenorrhea method,
Mm-hmm.
your second bone is in your belly. You're just getting ready to, please and please, lactation amenorrhea, fine. Some people self will not even have this lactation amenorrhea. They by 2 months after delivery, they are already menstruating. I personally, I was lucky enough because I was telling Dr. Mary yesterday when we were just talking randomly. I was like, do you know that I didn't even do exclusive for just 6 months? Because by the time 6 months was here, my baby said, no, I want only breast milk. There was nothing I didn't do to encourage this boy to eat after 6 months. I had to do exclusive for 9 good months. Imagine exclusively breastfeeding a baby boy 9 months, and I had resumed work at 3 months mark. It was an ASU. I started having to supplements with vitamin D and all of that because we all know breast milk doesn't have appropriate in the amount of vitamin D needed after 6 months for the baby. So what am I saying? Let me go back to the question. Please don't say you want to. By the time that baby is born, even here in the United States, when you give birth, they already give you like pamphlets on different contraception that you can choose from. Is it the pills you want? Is it the IUD you want? The copper or the hormonal? Is it the injectables you want? Is it the implants you want? From before you get discharged, they would have, talked to you about it and handed you the pamphlet. So people that are not here, that are back home, I know they talk about it to right from antenatal self, because back home when we do antenatal for mothers, we have a period where we will talk about contraception for them. So please, as right from before you are giving the go ahead at 6 weeks, please don't even say you want, if you know you are going to, if you know you are definitely going to have sex before you choose what method that is going to be a long-term method for you, please use your condom. Please don't even want to say you want to have lactational. It worked for somebody, it worked for my sister, right? But that doesn't mean it will work for me. Okay, before you put yourself in a situation where you have Irish twins. So please and please and please, by the time you are going on that 6 weeks appointment, already have which, if in fact at the 6 weeks appointment, do you know that they will even do pregnancy test for you at the 6 weeks appointment? You'll be like, no, I've not. They will still say, bring your pee, let's test and make sure you're not pregnant. Okay, and then after that, you now say, okay, this is what I have thought about. So don't wait until the 6 before you say, I will think about it at the doctor's office, or I will think about it at the clinic or something. Have it in mind. Start thinking about it, because even during the antenatal period, start planning ahead and talking to people. Or which method did you use? What are the side effects that you saw? The fact that this person had this side effect doesn't mean you will have this side effect as well. So start planning from when you are giving birth to that baby, or even before that baby is born. Which one would you choose? And please choose a method and abide by it. Thank you.
Okay, thank you so much. I feel like, ooh, just to add to what you've said, my experience, I am glad I had to use the IUD method 6 weeks. Immediately I went for my 6 weeks postpartum.
Like,
I told my
go on ahead.
gynecologist, sorry, my experience is different from every other person. I was combining
Mm-hmm.
a lot. And so when people ask me now, what are you doing? I'm like, I'm just taking my maternity leave and resting. Yeah, I'm starting work soon, but
Mm-hmm.
I'm also working like YouTube, coordinating the community. It's a job. But
Mm-hmm.
combining PhD research, I was working and
Mm-hmm.
I just had a baby. My husband was not like stable in this state. He only came to visit and he goes. He was also busy
Mm.
back in Nigeria. It was just a lot
My
on my
God.
plate then. I'm like, girl, don't sleep on this. And even before I put to bed, my gynecologist was like, Mary, what? I'm like, please, I need to finalize on what I need to do. What are my options? What are the risks?
Mm-hmm.
What are the benefits? Is it hormonal? Is
Yeah.
it copper? I was asking questions. And that's why
Yeah.
we're having this conversation. Yes, we can talk about, oh, just do this, do this. Experience for every mother differs. Maybe
Yeah.
you're a businesswoman. I talked about me being a researcher. She talked about she being a nurse and breastfeeding till 9 months exclusively. You can imagine that. So you need to prepare your mind, and it goes back to taking your prenatals. So talk more
Yeah.
now. I wanted us to just go that route of family planning,
Mm.
checks and the likes, but nourishment, it's been researched that
Mm-hmm.
breastfeeding mothers or people even doing mixed feeding most times are deficient of major nutrients,
Yeah.
folic acid, iron. You can't depend on just food at that
Mm-hmm. Just
moment.
the
So
food.
continue.
Yeah.
So can you talk more on um how to ensure that you are consistent with prenatals? Some people don't even want to take it during pregnancy.
See, the thing is, back home in Nigeria, right? They give you like so many pills. One is folic acid, one is ferrous, one is the vitamin C. They give you like tiny pills. But here in the United States, it's like one big pill or two small pills that you will take, or even gummies. Choose the method that you know you can. If you are someone that, I cannot swallow big pills, go for the smaller ones. Oh, I cannot swallow capsules, go for the tablets. Oh, I cannot do this, go for the gummies. Like, just choose one and be consistent with it. If you have to be like, okay, I'll be taking it in the morning, every morning into my mouth, every morning into my mouth. If you want to do it, oh, with lunch, it is at lunch I will have time, or it is when I'm doing this. Just time. You can actually time it with something that you know. Oh, I usually do this today every day. time it with that thing. Oh, it's time for this. Take your pills too. If you have to set alarm for it, set an alarm for it. Because you'll be surprised at the number of people that actually, I've met a woman, she lost all her teeth because she was pregnant and gave birth. All the calcium in her bones. She started having bone issues because she was not, all of these things, some of these, well, not in all cases, but mostly it can be prevented when you keep taking your prenatals, even after delivery. Most pregnant women, I personally, when I was pregnant, oh, come and see my hair, it was blooming and all. By the time I gave birth, I entered 3 months after giving birth. Oh my God, come and see, hair started falling out. But I was consistent with still taking my prenatals even after delivery. Imagine if I wasn't taking my prenatals and I breastfed till 9 months. What would even happen to me? So, like, it's the benefits actually outweighs that little like it's a disturbance to me. It's I can't swallow it. Oh, the benefits actually outweighs the little disturbance, or the this thing that you will get from actually taking the pill. Okay, so if you have to like set alarm for it, or if you have to time it with something that you would do, and that's especially for people who like, that's the same thing you can do for people who take pills as their means of contraception, right? You time it to something for you to actually continue taking it at that time, to help you remember to take it at that time. Okay, so that's what can actually help you to be consistent with it, because it can be tiring actually to continue taking pills even after giving birth. But the
Okay.
benefits definitely, is good.
Yeah. Also, I want us to talk about our children's health. Postpartum for us as mothers is tied to us
Mm-hmm.
bonding with our children. Yes, we sometimes
Yeah.
feel, oh, this is a lot, but how do our mothers in our community realize that your postpartum phase is a season and it can influence the growth of your child? If you're not well, you
Mm-hmm.
can't give from an empty cup.
Yeah.
The wellness checks for children and things like that. What are your experiences in managing work, still looking out for your son and ensuring he's growing well? I know that I see him.
Well, I mean, it all still boils down to you finding a way to strike a balance, right? Strike a balance between your motherhood life and work life and all of that. We have 24 hours, right? But I promise you, sometimes 24 hours look like it's 15 hours. Like something is cutting it and making it kind of lesser than it should be. But priority, that's the main thing. Yeah, as a mother, you prioritize your child, right? You prioritize the well-being of that child, right? That alone will help you to, be aware in that sense, to make sure that, oh, if something is going on and you're like, it is when you are aware that you can know that, oh, this boy is not eating well, or this boy is not has not pooped in 2 days, or the amount of pee this boy is having or this girl is having is not as much as, it is when you're aware that you can actually notice all those subtle things that could actually pinpoint if any bigger thing is actually happening in your baby. Okay, and then balancing things, it's just, let's say, time management as well. You have to be able to manage your time appropriately, to be able to be present for your child and still be able to function at your place of work. Does that answer your question? No, we can't hear you.
Okay, okay.
Okay.
Please, if you have a question, put it in the comments or the chat. Why am I saying comments? I've been on Instagram for a while now, I think. In the chat, please, our Zoom chat. Thank you. Um, you know, those number of diaper checks, number of wet and dry diapers, they are very, very important, especially for
Mhm.
breastfeeding. The first 2 weeks, even after leaving the hospital, I was consistent. And there are now apps where
Mhm.
you can just key in and try to
Yeah.
track. Because it
And
really
then it
helps.
makes a tally
I
for
know
you.
this app of what to expect, even Baby Center. There are different apps now that
Mm,
you can use. It's not a sponsor that, please. But I'm just trying to let you know that there are options, just like we use menstruation tracker apps now, menstrual
like
cycle
the flow.
apps, where even your iPhone can track those things. But caring for your child and ensuring that they are not falling ill, they are well nourished, and they are looking, if they can see that you are providing quality care for them,
Nutrition.
will depend on you as a mom. And so, please and please, we might have helps. We might have some people have the luxury of having living or
Mm-hmm.
doula, living nanny or doula. But if you don't have that, like she said, prioritize your time, prioritize what's most important to you. For me,
Yeah.
my family, you know, but
Totally.
prioritize your time to make. I'm not saying I'm the perfect balance, awesome
Mhm. Nobody is perfect.
first time mother, you know, but it's good to prioritize and be intentional about raising these kids, or even
Yeah.
if it's a newborn, because at the end of the day, you look back. I miss the baby stage now, like those
Yeah.
tiny moments where you be like, she's so little, she'll just smiling and
Mhm.
sleep, and they grow so fast, to be honest.
Yeah.
Then I
It's
didn't
a
feel like
pace.
that though. Yeah, they grow so fast. We're rounding
Mm.
off. Please, if you have questions, put it in the chat. But one or two questions I have for you before you go, our time is almost up, is let me talk about putting baby in the crib. Some people are like co-sleeping is better. Research, as American Association of Pediatrics still recommend baby sleeping in the
Putting baby in the
crib,
bed.
and
Hmm.
no, nothing should be in the crib. Like
No
baby
bumper, no
safety.
pillow, nothing.
Yeah.
Yeah.
But how do you encourage some moms that, that peak period of 2, 3 months, the baby needs more warmth, more attachment. They now realize, oh, I'm outside the womb. The first 1 month, they're still
Mm.
trying to, "Oh, where am I? Where am I?" So how do we encourage our moms, the crying and still trying to pacify the babies? How was that for you?
Well, I mean, luckily for me, I had a baby who was like, he rarely cries. If he cries, it's either he's hungry or that diaper is wet. Apart from that, I was just, let me say, I'm part of the lucky ones. Okay. That their baby started sleeping through the night early. Glory to God. I'm part of the lucky ones. But but if you have like a baby, like now, it's the same way we are like trying to get used to being a mom. That's the same way this child is trying to get used to being outside of the womb, trying to get acclimatized to this. Here in the United States, for comforts, right? We swaddle the baby. We believe that the baby in utero, they had this position that they were in that
Mhm.
actually gave them the soothing and the comfort that they needed back in the when they were in the womb. We swaddle them. That might actually help you even when you have to put that baby. But most importantly, if you can get a bassinet, if you have a baby that cries so much and you can't put them down and all of that, instead of take for instance, you just give birth, right? Okay, let's even go beyond the first 6 weeks. After the 6 weeks now, and the baby is getting used to, oh, I'm outside of the womb and all of that. Oh, I want you to carry me and all of that. If you can get a bassinet is like a mini crib that you can put beside you on the bed. That way you don't have to get up because it can be really frustrating for real. If you have to get up, feed the baby, do you know the number of times the baby can sleep 2 hours and then every two hours they are waking up to eat in the middle of the night to suck breast in the middle of the night. And we've seen cases where people will actually say, well, they want to put their baby on their side and then they sleep on top of the baby and something else happens. It's just to prevent it. That's why um we advocate for actually having a safe like a sleeping place for the baby. So if you can get a bassinet, put very close to you on the bed. That way you just stretch your hands, you get that baby, put them to breast, and then stretch your hands and put the baby back, and you are good to go. You even have bassinet that can rock the baby. All of these
Now,
things is money.
we can afford
All these things
it.
is money. If your money can do it, there's
Or
comfort
if you
in
know
this life.
about it too. Some
Or if
people
you
have
know
the
about
money,
it,
they
some
don't
people have
know.
the money, but they don't. There are person that can rock your baby, just provide little subtle movements, and they're like, it is until the diaper is wet or they are hungry again before you hear a real cry. Then you carry feed again and
Okay,
this.
thank you
So,
so much. Like they say that ọbẹ̀ tó dùn, owó
oh,
ló pa.
yeah.
In Yoruba, that's what's the translation now? That if you
It,
want to enjoy some benefits, you should plan for it or have the
have
money
the
in your
money.
pocket. May the Lord provide for all of us. So good. Amen.
Amen.
Okay,
Amen.
I will also talk a little on nutrition before we go,
Mm,
because today is the last session in this series. Next week, the benefit of breastfeeding. I'm going to work on a course with the other dietitians in our community, the volunteers, to do a
mm,
course, and I will talk about that more in our group chat. Nutrition for new mothers. A mother breastfeeding should plan for additional 500 kilocal to their meals that they eat before. But hydration is really, really important. Even breastfeeding, or you are trying to wean, because you as a mother, you don't want to be dehydrated. You just feel
mhm,
that lack of energy and protein intake, more importantly. In
mhm.
Nigeria, those nurses, I worked in General Hospital, one of the ones in Lagos, can't remember in Agege Essex now. And that was during my undergraduate. And when I was there, the nurses would say, "Ẹyin, ẹja, ẹ̀fọ́, kíní kan." Like there's a song they
Yeah.
used to sing during antenatal. It's very true.
Yeah.
Protein intake, and I'm saying that in Yoruba means eggs, vegetables, fish, beans.
Mhm.
In the US, we have broccoli, like green leafy
Yeah.
vegetables have some sources of calcium, but more importantly, legumes, dairy, nuts, those ones have calcium, but also more importantly, protein intake add to your
Mhm,
meals. And
mm.
if you need help, seek a dietitian, consult a nutrition coach or health coach, but from accredited sources. I'm very serious about that. There's a lot of misinformation out there. There's a lot
Mm,
of just try and avoid being nutrient deficient, because it spirals. Yes, you need to go see your gynecologist, see your physician, but that's why we're having this. What are the things to ask and advocate for yourself when you're going there? Oh, please, can you check my metabolic panel? I think maybe
mhm.
I just feel so. Those things will help them catch some things. Now, people are advocating for holistic health. Are you checking the protein levels of this person? Is this person iron
Mhm.
deficient? Anemia is a major thing among women of reproductive
Yeah,
age.
that's an indeed
Ferrous,
deficiency.
yeah. So many things that we don't know. We just go to the hospital, and especially if you're from minority population and you don't know what to ask, you just be like, okay, they say you're fine. I think you're good. You're smiling, right? And that's it. Or your print threshold,
Mhm,
you are not talking. Please advocate for yourself. If there's something your mother instinct or mommy instinct for your baby, for yourself, ask questions. And before we finally allow Miss Olajumoke to go and enjoy her day with her family, what will be your parting words to our community members, both in the US and those joining from Nigeria or any other time zone, because we have different mothers represented across the globe here in our community.
yeah, okay. Yeah. So, um, let me say this, for the mom, right? Just within you, be kind to yourself. Be kind to yourself in such a way that, know that you are not an island. If you are kind to yourself and you know that you're not an island of knowledge, it helps you to actually vocalize and verbalize if you need help. It helps you to observe and ask questions when you see things that are going on and you're like, is this right? Is this not supposed? Is this how it's supposed to be? Is this not how it's supposed to be? Or things like that. So be kind to yourself, especially and also physically as well. After giving birth, you don't expect that belly to go down flat immediately. Be kind to yourself. I forgot to mention that it was part of it because I wanted to mention in the physical part. Be kind to yourself. Know that belly didn't just become big in one day. It will not go down flat in one day. Seek help. If you think you're having probably diastasis recti or things like that, seek help from professionals. We have physical therapists who can actually help you with good exercises to help build your core back. So be kind to yourself as well as be kind to your baby. Be kind to yourself, be kind to your baby. Eat well, sleep. It can be difficult to sleep, but still try to find time to sleep. Okay? That's the main thing, honestly. And eat well, sleep well, and pray. You'll be fine. Give it time. Even if everything seems to be tough, give it time. Things pass. This too shall pass.
Oh, they said this too shall pass, but you know what? Enjoy the moment, please do.
Yeah,
Someone
yeah.
is asking, what's your take on pacifier? We are having some questions now before.
Pacifier. Well, pacifier, as the name is to pacify the baby, right? When you know that, when you know that,
Thank
okay,
you.
this so when you know that the baby is actually not hungry, you fed this baby, but they are in the oral phase.
Yeah.
They tend to get comfort with their mouth, right? They suck, they bite their hands, they do things. They just want the mouth gives them comfort. So that's why we use that pacifier. But in as much as we use pacifier, we still should not let the baby become dependent on pacifier. I personally, when I first started taking care of my baby, then we started with pacifier with him. Pacifier would help him to sleep at night. But then it started getting to a level where this boy would choose to eat pacifier, chew, chew, chew pacifier, and not suck. He just wanted the pacifier. I'm like, okay. At 3 months mark, I took that pacifier. So people will be like, reduce it slowly. I personally just took it, and it was tough the first 2 nights because normally we'll suck that pacifier and then he will sleep off. But then there was no pacifier for him to suck to sleep off. It was tough the first 2 nights. But afterwards, the same way, babies are stronger than you would think. Carry that baby, rock that baby instead.
Okay.
Because if the baby actually keeps taking that pacifier and keeps chewing it might not be your own, might not be that the baby will not suck. The baby might actually so but you see some children 2 years, 3 years, they're still chewing on this pacifier, and then it starts affecting their dentition.
Yeah,
So
so
yeah.
actually, you're very correct. I'm sorry to cut in there.
Yeah.
Time, but more importantly, it's not even advisable. I think the lactation consultant will say
Mm-hmm.
to establish that latching well, breastfeeding,
Yeah.
you need to reduce pacifier. Before you introduce pacifier, ensure that the baby can self-soothe,
Mm-hmm.
before you know it now, without the pacifier, they can't self-soothe themselves, even when
Yeah.
they need that. And there are new evidence coming out in research that even a breastfed baby have a better dentition and things like
Mm-hmm. And
that.
speech.
Yes, and speech. So if we are looking at the holistic and overall well-being of ourselves and our children, we should encourage ourselves not to even use or use if needed, not like you leave it in
Mm-hmm.
their mouth.
Yeah.
And as a round off, if you're in our community, we have a gift from a company, a baby bottle company, Swavinex. And so please watch out for more updates. I'll be giving out those bottles, especially to the mothers here in the US. My other community members, I will look out for a gift for you, but this was shipped to us from a company in the US, and for shipping reasons and logistics, I can only pick members that residing here for shipping logistics. So we're going to give more updates on that. I will make an Instagram post and also share on the group. about the gift. So thank you, everyone. We appreciate you sticking with us every Saturday throughout this month of August. I will
Mhm.
tell you, it's a good commitment for us. And
Mhm.
I believe that all the gems our guests have shared with us will be used and applied to our motherhood journey. Thank you so much, everyone. I remain your team lead. I call myself a team lead, not just the founder or something, because I believe that we are all working together as a community. We provide support to each other and we encourage ourselves being accountable to the community goal of health and food literacy. Thank you, everyone. Okay, bye.